just wait for people to start to trickle in. Good morning, afternoon, everybody, depending on where you're dialing in from. We'll just give it a few minutes and let people settle in a little. It's always the awkward bit where I feel like I have to keep talking while everybody arrives.
Why don't we have a conversation? People who are attending can listen to us chat. We have some fascinating conversations, man. That's what we should do. Give them a real insight.
The real taste as to what we talk.
How we work.
Maybe not. We were just moaning for a few minutes, or just while everyone's arriving. I had a big run this morning and got devastatingly splashed aggressively several times by passing traffic. So we were just moaning about that first world problem, weren't we, as we dialed in? Sharing tales. Give them nothing, is what I say. Smile. Make out like they've done you a favour. Right. We've still got people trickling in, but just while people are arriving, we'll just do a tiny bit of housekeeping. There's a number of people that are joining us today who Colin and I already know. We've actually got a few of our coaches dialed on as well this morning. So thanks, guys, and hello. In the event that anybody hasn't met us before, I'd like to introduce my fellow co-founder, Dr. Cole Robertson, Education Director for Cause. And anybody who's not met me before, I'm Mel Spooner, Cause MD. We're going to run through today's session. If you guys have any questions once we get started, please drop them into the little Q&A box. We have left time for Q&A at the end. If we get a chance as well, while we're chatting, Colin and I will try to dive into those and have a little bit of look if time allows us. Otherwise, let's get stuck into today's session, in which we're going to focus on COVID-19 Recovery Plan Part 1. Part 1, because it's very much a moving beast, as we all know, and there's certainly lots of moving parts, and also because there is still a lot of unanswered questions. So this is the beginning of a much bigger conversation that we expect to have with you all as we move forward. So to kick in, by way of intro a little really, if anybody's not joined one of our sessions previously, Carl and I are co-founders of an education company called Cause. Our goal is to create content, courses and curriculums specific to your needs. So anything that clubs, coaches tell us repeatedly that there's a gap in our sector in terms of a skill set or an educational need, then Carl and I and our team seek to establish that and deliver that to you guys to help you develop your businesses and your practice. Back in May 2020, we developed 3 short courses in response to the COVID-19 pandemic that we believed would help support clubs and coaches come through the other side of COVID-19, which at the time, of course, we were expecting clubs to reopen in July, which of course they did, but then for things to very much, improve from there on. And clearly things have only gotten more crazy as 2020 continued and moving into the new year. As such, one of those 3 courses, which is called Rebuild, which teaches trainers and coaches how to rehabilitate individuals from COVID-19. That's something that Colin and I and Cause has become best known for over the last 6 to 8 months. It was never our intention, if I'm honest, for that course to have to play such a flagship role in our portfolio of education, but organically, given the situation, of course, that happened. Back in May 2020, none of us could have foreseen that COVID and the role of COVID and long COVID would have played such a huge role in our society. That said, though, Colin and I had always wanted to create something that was bigger than us, that was bigger than an education company. And it just so happens that because of the circumstances around 2020, we've now become heavily involved in the role that we play as an organisation and that we can play as a sector in the rehabilitation of the global population from COVID-19. And frankly, it's hard not to care, and it's hard not to be involved in this. And the purpose of today's presentation is to show you the difference that we can make as a sector and the difference that we're already making. And hopefully you'll be able to come away from this session with some tangible ideas of some changes that you guys may be able to make straight away as well, as businesses and as coaches. So to begin, and to break up the session a little bit, we're introducing a couple of guest speakers by way of video, also to break up Carl's and my Stoke and Scouse accent as we move ahead. The video is a bit of a thank you, if I'm honest. A thank you to you guys. Some people might think that's a bit cheesy, but it's a thank you to you guys. It's a thank you to every single person that in the last 8 months has joined a session with us, a webinar. It's every coach that has dedicated time to learn more about what's happening around them and with their clients in the last 8 months. And to demonstrate the difference that that's been making to the individuals who have been affected, we've got a video now with 2 individuals in it. We've got Jan and we've got Chris. Jan is our long COVID icon, if you like, as I like to call her. Anybody that's seen some of our video material before or been in some of our sessions may have seen Jan. Jan contracted COVID-19 back in March 2020. She certainly hasn't had the worst type of response to COVID-19, and her long COVID symptoms aren't the worst that we've seen, but they're pretty bad. Throughout most of 2020, she continued to suffer from chronic fatigue, breathlessness, almost permanent pins and needles, headaches. She was in and out of hospital for a period of time at risk of a stroke. Back in November, she still couldn't really walk more than about a quarter of a mile without experiencing problems. And this is a woman who has continually dedicated her life to fitness, training regularly 4 or 5 times a week. So this is someone who was part of our world. She was one of our members. Today, I'm really pleased to share that she's now comfortably walking between around 3 and 4 miles. Without a negative response or any negative repercussions to her recovery rate for COVID. And that's because of the work that she's been doing with other people like you guys in our sector. So I'll hand over to Jan to explain a little more. Just as a small caveat, the video is a little bit longer than we intended for it to be, but it goes a long way to explaining the work that it is that you guys do.
If anybody said, you're not going to be able to do any exercise for 10 months, you'd be like, that's just so far off my radar of comfort. It's horrendous. When is this going to end? When is there going to be light on at the end of the tunnel? And I was becoming depressed. But the thing was, I didn't know I was getting depressed. It was my friends that told me I was getting depressed. I couldn't, because I've never been depressed. So I didn't know what it was like, but I was just, I could see in retrospect, I was closing in on myself, because there's a thing about feeling there's no real, when will this end? But the other thing is, as somebody who's always enjoyed taking exercise, you get a lot of endorphins out of taking exercise. And when you become sedentary and not doing it, you're not getting any of that either. Mm. So that's a double whammy, really. And so that was really quite a low point back at the beginning of November. And also winter's coming and you're just going, oh, I've been doing this for so long and I'm getting more and more unfit and I can't do anything. And it just all seemed very miserable. And what I really needed, which is what Chris has provided, was somebody to metaphorically hold my hand and go, okay, now then, Jan, let's just assess where you are. And even though you acknowledge that compared to lots of people, you haven't had it really badly, but let's just assess where you are and look for a route about where we can take you and how we can take you through this. As the person in the middle of the family, So I have elderly parents and I have grown-up children and a husband and everything else. But I'm still the one that is the core that melds everything together, that basically keeps the wheels on the road in our family. And you can't really say to everybody, actually, I'm struggling, because then they all get upset and they're worried because you are, they then start worrying about you. And as a wife and mother and daughter, you don't want other people to worry about you. You need to be the strong one. And actually to be able to talk to Chris, who was somebody I didn't know from Adam, I spent quite a sizable portion of our first interview in tears. And having never had any counselling, having somebody completely impartial that I could talk to, that was non-judgmental, very understanding, but I could share that burden with, was really, really, really therapeutic and helped me enormously. So it was having that counselling element, plus then somebody who could give me a plan about how to move forward. I'm not the first that said that. A lot of people have said, you weren't really yourself, but you seem a lot more back to normal. And I am a lot more back to normal. I am. But I think I am getting to the end of long COVID as such. But there is what I now have to manage is the lack of physical fitness that that it's not just long COVID before I met Chris, because I was at that stage thinking, oh, I don't know if I dare go out or do anything, because I think I'm then going to be. So I was very nervous about doing anything. But that's why it's been great, working with Chris, because he was able to establish what my baseline was and how we could build on that together, which I wouldn't have been able to do on my own. Because that's why getting depressed was I was getting into this going, well, I don't do anything and I don't go out, because I didn't understand how to work with it.
We're now starting to move into a slightly different phase, and it's not a black and white change, because we are, I think, zooming out of the whole situation and Jan's journey, is that we're moving from a rehabilitative focus from long COVID, and we are starting to introduce elements of my intervention, which is more linked to her deconditioning of having done nothing for 11 months. We're starting to move into another pyramid, the base of which is mobility, is balance, it's coordination, linked to the next level of exercise. And the next level of exercise for Jan is reintroducing slowly the things that she loved doing a year ago and beyond. But what we have to make sure, and you alluded to it a moment ago, is that that base needs to be deep enough and wide enough that she doesn't pop an Achilles and be out for 4 to 6 months because we've gone at it too soon, just in the same way that we wouldn't go at it too soon through fear of a relapse when she was battling the spearhead of long COVID. So we're making excellent progress, but it's always with this this warning sign that we can always go too hard too soon, regardless of how much progress we've made. So we have to be very careful, because, and this is one of the biggest things that I learned from Jan, probably quite early on actually. It was late November, December time, and it was actually that the physical challenges associated with long COVID is a relatively flat line. Things change, symptoms change, but the way you feel about it is, or the actual physical symptoms are quite flat line. But the more you go through this, the longer the journey becomes, the more of a mental challenge and a battle it is. It supersedes the physical stuff. It's such a mental battle, an emotional battle, which of course has this sort of self-fulfilling cycle of stress, of anxiety, which is a stimulus, which can trigger the other symptoms of long COVID in the first place. So it's very easy to see how that spiral can get deeper and longer, but we have to find a way of breaking it. And thankfully, I think we broke it not before time with Jan. That was the most important bit.
Absolutely get help, 100%. I can't believe why anybody would not do it. And I just think having personal one-to-one bespoke help is the best thing you could possibly do. I mean, I know Chris is here on the conversation, but it has literally completely changed my recovery and life in my post-COVID era. And if anybody had said to me, back in the day, would you like to have some counselling? Do you think it might be a good idea, somebody to help? I might have gone, oh, well, I'm probably all right on my own. And I would now say absolutely 100% it's the best thing you can invest in.
You have a huge impact on that individual's life, and you need to make a huge impact on that individual's life, because the alternative is so grave, and the steps back that you can take with one wrong move are so vast that you've got to be on it from the first session onwards. And the Cause Rebuild course gives you that confidence and gives you that grounding, so that you feel like you can impart that knowledge in a way that gives the individual client this self-managing ability. And that's the best thing I can say about the course and the subsequent relationship that myself and Jan have had.
It was listening that I really appreciated. I really felt that Chris listened to all the gabble and garble that I was telling him, and then managed to sift out from all of that the really relevant nuggets that he needed. So even though he's talking about the nuggets he got from Cole about these little sound bites about pushing up to the ceiling, he also really listened and pulled out relevant bits that he needed to know about me, because he didn't get them in a list of bullets. He got it in an hour's conversation that went all over the place. And that's a real skill, because you can hear, but you don't necessarily listen. Thank you. And I'm really grateful to you and, to both of you. It's been fantastic. So, because I wouldn't have necessarily found out about it or got involved otherwise. So it's been a real win-win for me.
So if that's not a little testament to the difference that clubs and coaches in our sector can make to people during COVID-19, then I don't know what else can say it more. And I know that will also resonate with some of our other coaches watching who are already working with other Jans. Stats. We're not going to go massive on stats today, because we normally do go massive on stats, don't we, Carl? So if you've watched sessions from us before, we certainly don't want you to hear too much of what you've heard before. So just to illustrate how big a situation we're dealing with globally, not just in the UK, and how many Jans there are out there, we'll just sort of share this little mini illustration on screen. So you can see that this map of the UK is gradually turning into a darker colour. For our international viewers watching, I apologise that I'm using the UK as an example, but of course this mirrors what's happening across the world. For anybody that's not seen this graphic before, although it's highly unlikely that you have seen it before because it's shared very often in UK government presentations, this just shows the COVID case count as it has risen over time throughout the UK. In previous presentations, Colin and I will often talk about hotspots areas of the UK that have been more affected by COVID than most. But given the situation over the last couple of months, you could arguably say now, for example, in the UK, every area is a hotspot area. Indeed, at one stage, probably even as early as recent as mid-December, there wasn't even a dark purple on this map. And as you can see, as we get to sort of present day, everywhere is this dark blue, dark purple colour. From a statistic point, just for context, but it's a really, it's a good way of summarising the situation and provides some perspective. In 2020 through to December 12th, 1.7 million people in the UK had COVID. In the last 6 weeks, 2 million people have contracted COVID alone. So now 3.7 million people in the UK have COVID. So that just gives, in a real little snapshot, gives you an idea of the rate of change and the rate at which there's more Jans popping up across the country, but not every Jan is getting help. I mentioned before, oh, I knew that was going to happen then. Trigger happy fingers. Sorry, guys. I mentioned before when Jan came on, again, just real quick for context before we get stuck into some more of the meaty stuff, that Jan had had some pretty severe COVID symptoms, but she certainly hadn't had the worst. Chris, that you saw on screen there, is her recovery coach. He's her rehab coach, but here on screen is an example of some of Chris's other client situations. Point being from this slide is when we say more Jans, most Jans look very different from one to the next. So some of the individuals that Chris is working with, it's still there's still a group of the lost taste, smell, period of isolation group, kind of mild symptoms, not too laboured with fatigue issues, right the way through to some of the far more complicated, complex scenarios that you see on the screen there. And as I mentioned previously, there'll be some of our coaches listening in who again can resonate with the variance between the situations that they're faced with. We don't put this sort of information out there to scare, for want of a better word, to scare coaches from working with individuals in these complex situations. It's there to illustrate just the variety of effect that COVID-19 is having on individuals. But also, as you've seen in the video with Chris and Jan, we have the ability as a sector, because of the background that we have and the foundational understanding that we already have, to unpack these sorts of complex situations and put people on a road to recovery. How is that happening? How is the country putting people on a road to recovery, and what's the rehabilitation system looking like? We posed the question as part of this webinar, where do we fit in as a sector into the government's plans to rehabilitate the nation from COVID-19? As you can see from this graphic, it's all pretty disjointed at the moment. It's all pretty fragmented. There's a ton of individual groups here, and Col will speak to some of those in a moment. But for the most part, a lot of these groups are working in isolation. And in some instances, even, right hand's not speaking to the left hand. And that's really what's bred a lot of frustration between our organisation, between Col and I, and we very much tried to navigate through and join and be a part of a lot of the groups on this screen, so that we can bring bigger alignment to where they're headed with our sector to see how we can help. When Col and I spoke about the role that we can play as a sector in amongst this group, Col used the phrase, "We have got to build ourselves in." So I'm going to pass over to Col just to explain a little bit what he meant by that.
Thanks, Mel. What I meant by that, and quite a reactive comment at the time, is that we can't wait for a green light from somebody else or permission. And I say this without trying to be controversial or provocative, if we look back over the past 10, 20, 30, 40 years with regards to the context of supporting people within the community who have dealt with chronic disease or illness and are post the primary care or acute stage. So they're no longer identified as a patient, on whatever terms you might consider that to be. They're back in the community and they are left to their own devices. And we know, without trying to be dramatic, the sometimes devastating consequences that's had, particularly to a person's quality of life. And right now, we've got an amassing notion of what truly happens in the wake of COVID-19 with regards to this ever-growing population of people who we can call them long COVID, we can call them long haulers. We're starting to kind of put descriptors around that as to what that might mean, because they're broad descriptions at the moment. But in around even those groups, there are people who've had COVID-19 and are still not quite fitting that mold, but it's taken a long time for them to get back on track. Common things that they do is they push too hard too soon. They treat it like they've had a normal flu or a cold, and they go, well, that's it, I'm no longer symptomatic, so I want to go back to what I was doing 2 or 3 weeks ago. And that only makes a bad situation worse. So what do we have to do? We have to build ourselves in. We need to take this moment and we need to start to own our part of the narrative. The fitness space is where health and fitness takes place. That is our environment, that's our profession, and we shouldn't be shy about it. We shouldn't be holding back and waiting for permission. On a similar theme but a different context, the American Association of General Consultants issued a research paper with regards to vitamin D deficiency. And what I loved about that paper is they said, look, we can track all these different levels. We know that vitamin D deficiency is an issue with regards to severe symptoms in COVID-19. But the line I liked was, we can't wait for perfect data. We can't all wait round for perfect data. And sometimes we're guilty of that. We're waiting for permission from the research lot. I'm a researcher, for them to go, yes, it's definitely that, so we can do this. We're waiting for permission from some kind of legislation, maybe from, NHS or whoever it is, to go, right, you can do that. And it's a nonsense, because these people are left to their own devices. They are in our communities. And whether it's someone who's previously received their diagnoses for type 2 diabetes, they've survived cancer, cardiovascular, whatever it is, they're back in the community, and that's kind of right, well, you figure it out. More people are going to be in that circumstance when it comes to COVID-19. Now, fortunately, I'm a part of the Advanced Clinical Practice group that is working with Health Education England, so that we can look to bring these worlds together. So we want to look at increasing the education and understanding of our clinical colleagues, and we want to look to where we can build those bridges to our fitness colleagues, because it needs to take place in that space. That's a recognition from the staff in this group. This rehabilitation and the long-term nature of it has to take place within the health and fitness space, not in a hospital. £10 million on rehabilitation services is a drop in the ocean. It will have some impact, but it will also create a postcode lottery with regards to what kind of care a person gets. And we've already got a massive disparity of care when it comes to the normal things, COPD, cardiac, cancer, and we're trying to fix that. So this new and ever increasing numbers of people who've had COVID-19, they just add to that critical mass. So we need to build ourselves in. We need to have the conversations with our clients, with our community, with our local PCT GPs. We need to be letting people know that we are there, and that once a person is past that acute critical stage and what becomes the rest of their journey, which should be lifelong. We all know that. I'm singing from the same hymn sheet that we believe in. That's what we do. That's what our skill set, our expertise, our profession is all about. It's about making health and making lives and quality of life better for the long term. And the NHS don't do that. I say this all the time, Mel, but I'm going to say it again. And every time I say this, I say I'm going to say it again. We don't have a health service. We have a sickness service. You engage with the NHS when you're sick, and it's doing the best job it possibly could, given the financial restrictions that are all around it. I'm hugely pro NHS. But once you're no longer categorized as ill, acutely ill, you're not their issue. You're our issue. That's what we do. We breed health. So we've got to build ourselves in. We've got to be public about it on social media, social forums, but more importantly, we've got to be proactive within our communities, because all these groups, whether they want to admit it right now or not, need to recognize that the infrastructure they need exists. That's ours. Every single independent gym, massive chain gym, leisure center, we have that infrastructure. It exists. You don't need to get your shovel out and build one. We've got it. We've got a skill set and expertise amongst our coaches and our PTs that know how to work with people to support and prescribe their long-time exercise behavior and their physical activity behavior. And that's why what we've put into the cause programs, all three aspects of it, but particularly in Rebuild, is the notion of let's get back to brass tacks. Let's do what we do really, really well. Let's be mindful of the contraindications, the complexities, and let's look for roads forward. And it was really, you know, that's the first time I've seen that video. And there was a huge swell of pride when you look at what Chris has done and how we've been able to play a part in helping him to be able to do what he does really well, which is to give him that confidence and increased level of understanding so that he can work with those, you know, the Jans of the world. You know, that's what the mission is about. And I was in a clinical group on Tuesday of this week, and we were debating, you know, the whole point of that group was to debate the rollout of the vaccine, the impact we expect the vaccine to have, and what it means to our populations. And the head medic in that group said, let's all be clear. Everybody should assume they will get COVID-19. That should be everyone's assumption. And if you don't, that's a bonus. The vaccine does what the vaccine does, and the vaccine is incredible, but it doesn't mean that once you've had it, and everyone knows this, you can never get COVID-19. It dramatically reduces your chances, and you keep having to have it sequentially because the antibody profile doesn't last long enough. So there are huge windows of opportunity for everyone to still be infected with COVID-19. And thankfully, most people, even with the new morph, don't get the most severe symptoms. But unfortunately, there's a growing population of people who, once having had it, don't find going back to where they believe they were previously or rehabilitating themselves a realistic option without support. And that's where our industry needs to kick in and take over and take the reins and lead that charge.
As Carl rightly explains there, our sector is a bit of an anchor. Well, it is an anchor in our community, and it's an anchor in the middle of every single person that's been affected by COVID-19. When we're in sessions where we talk more about how to mobilize like a rehab program within your communities, we go into this slide in a little bit more detail. But just because of the nature of the topic today, we're going to spend a bit less time on this slide. But really, it clearly illustrates how central we are to all the different elements in our communities, whether that's through our existing clients and members that have got COVID and they need help, members of our community who may have never had a gym membership in the past, but they are, like Jan did, struggling with COVID, struggling with long COVID, and they want to be able to access something on their doorstep that can provide them with the help that they need. As Carl said before, the NHS, local general practitioners are doing the absolute best job they can, but they cannot provide aftercare for everybody, particularly at the volumes at which the case count is increasing. Not to mention the fact that, as Carl said, for the most part, if it's mild symptoms, people are told to stay at home and isolate. So in some instances, some individuals have never been able to access any primary care. So that's where we step in. Schools, colleges, universities, we know there are students that have been affected, and we've had schools contact us trying to find out where local club facilities are local to them, where they can cooperate to help students who are dealing with long COVID, and corporate rehabilitation, again, to keep using Jan, and she's become her own little trademark in this presentation, but Jan, again, professional woman, struggled with concentration when she could commute to work, when that was a thing. Driving was an issue. She couldn't walk the length of the garden at one time, so attending meetings was becoming an issue. Some of the clients that Chris works with, his actual rehabilitation program involves simulating a working life at home so that people can start to understand the demands of work life in a safe environment. So where we have worked with corporate outreach as a sector since the dawn of time, what that looks like now has an entirely different meaning. And corporate organisations are way more willing to buy into that because of the situation, but because of the volumes of people that they have simultaneously off, out, sick, and they have a duty of care and want to be able to provide a different type of solution for their employees. So this is a whole collection of all the populations around us where, exactly as Cole said, we are able to step in now. We don't necessarily need to wait for funding. We don't have to reinvent our facilities and infrastructure. It's something that we can be part of. And not to forget, as we say at the top of the screen there, this is in a COVID-19 environment, but this is where we step in and support the NHS in all the areas that we work in. So post the COVID-19 era, the new systems, the new dialogue, the new relationships that we will build in this immediate phase then means that we're far more ready to help every individual who's in a similar situation dealing with cancer or diabetes or COVID or cystic fibrosis.
On that note, Mel, just to feedback, because I'm a part of that network group and what we're working on, what's been identified quite rightly, and we were discussing this 8 months ago, Mel, and having this conversation with people through ukactive and other forums, is that they recognize that the comorbidity issue, people having multiple things, so overweight, obesity, type 2 diabetes, cancer, cardiac disease, has again used the term reached a critical mass, and that people need support with that, because what happens once you start to go down that route, you're far more likely to develop a second, third, and even fourth disease consequence by virtue of the fact that you had one. So what they're recognizing is one, and this has literally been fed back from the head of that group, fitness professionals. That's their expertise. That's what they do when it comes to making people compliant to those types of behavior changes. So we need to merge with that industry, because that it already exists. And what is recognized, and again, what we try to put into the programs that we put together, is an understanding of language, so that we understand the medical terminology and language, and they understand our language. It's not about making medical clinical health practitioners exercise specialists, and it's not about making PTs and coaches clinical specialists. It's about us all understanding each other and having real ownership over the part that we're responsible for and that we're masters of. And we own the big part. You know, acute health is great at saving lives. What we do is give lives back to people so that they're not restricted to poor quality of life, poor physical functioning, low self-esteem, depression, anxiety, all that kind. That's what we do. That's our area. We breed health and fitness.
So if the plan is to ready ourselves as clubs and coaches to rehabilitate individuals from COVID-19 and bigger populations on the other side of COVID-19, how are we performing as an organisation? How are we progressing against our plan? So those groups that we saw on screen before, those different pockets of research and task force and driving groups, we're not operating in isolation as an organisation. We're driving for cohesion with every single one of the groups that you see on that page. So we have a dialogue or a relationship or a collaboration or the beginnings of a conversation, at least, with every single one of the groups on that page. Our role, as much as possible, is to make sure that the right hand is speaking to the left hand and that we are working together. We are sharing a consistent message with the consumer, and moreover, sharing with those groups the message that we as the fitness sector is a solution here, because as a nation, as a global population, so much of what is discussed, especially what is shared through social media, focuses on the issue. And I'm not trying to downplay COVID-19 or the virus, clearly, but so much conversation is around the problem, the size of the problem, a review of the problem, a review of tons of focus groups of people that have had long COVID, which is important and essential for us to get to the bottom and the root cause of the problem, clearly. But very few conversations are happening around the solution and how we get people out the other side. And that's why we're banging the drum so hard that our sector is the solution, because enough talking about the problem. Let's all work together to build people out of it. So to help to drive the message that we as a sector are the solution, and without exaggeration, we've probably had conversations since November with around 4,000 clubs globally about what they can do, how they can help, and how simple and easy it is to integrate in the current services that they already provide for their members. Currently, right now, our latest cohort of coaches going through the Rebuild program is 176 coaches. What I mean, just to sort of elaborate on that point a little bit, we will have level 3 personal trainers, S&C coaches, degree level individuals who have a solid base understanding, a foundational understanding of how to work with an individual. And what we're doing is giving them probably 15 to 20% of additional information in the context of COVID-19, which makes them ready to go and tackle these new situations. As you've already seen, Chris, on the video previous, we have active cause rebuild graduates out there at the moment working with individuals and making a difference. And we've also got a number of pioneering projects on the hopper. By that, I'm not saying we're being pioneering. There's a number of clubs globally that have come to us on the basis of some of the work that's already taken place. And they really want to get behind in their own right, in their own way, according to their own business, how to mobilise solution for their members to help them in their COVID-19 recovery. So all those sorts of discussions, wherever we're able to help, we can and will. Hopefully it's pretty clear by this point that Colin and I aren't the sorts of people that like to sit on our hands with such things, and if we can help, we'll definitely muck in and try. We still have a few challenges, obviously. There's a ton of unknowns. Clearly the nature of what we're dealing with. I don't need to tell anybody on this call that we have a little surprise thrown upon us every few days, and we have done for the last 12 months. So we're dealing with an ever-evolving landscape. Similarly, there's still a ton of inconsistencies around the reality of long COVID in terms of symptoms. I've said several times on the call already, and I promise this will be the last time I say it, but the complexity and the range and spectrum of scenarios with clients is going to continue to change, and it's still going to be really hard to classify almost into buckets of what a type of long COVID individual looks like. And that's consistent with what all the review papers are saying at the moment. What that means is there's no one size fits all situation at the moment, which also emphasizes why the role of the club and the coach is so vital to, as Jan said earlier on, sort of needing a situation as best fits the individual. So because there's still lots of question marks and there's all these moving parts, to be as responsive to that as possible, we set up team talks that we do in response to urgent or new updates with the coaches that we work with. And we do a weekly business video update to all the clubs that we're working on projects with, so that they know all of the up to the minute latest key bits of information that they need to understand with regards to long COVID or the new strain or the vaccine, etc. And that's also the reason for calls like this that we do with ukactive, so that we can share and be as collaborative as possible with everybody who has a vested interest in this. Funding is also a challenge. Not everyone is going to be able to afford the help of working with a coach. Rehab programs, the COVID-19 rehab programs that we've been a part of mobilising, they don't all rely on paid for PT. There's lots of organisations that we work with or that we're speaking to that are keen to embed it into their services as part of the course of being a member of a facility. But there are going to be instances where, particularly against a backdrop of the financial crisis that accompanies COVID-19, that clubs and individuals are going to need to charge to be able to provide this as a service for individuals. We would like to make sure that as many people get help as needs it. So there's a ton of work that we're doing behind the scenes to try and access funding for the consumer as well as part of what we're doing. Another one of the biggest key challenges that we're still dealing with is awareness. And when we say awareness, what we mean by that really is awareness of the reality of the situation when it comes to someone who's had COVID-19 or who is dealing with long COVID. Very few people now question the seriousness of the virus and the impact it's had on our lives. But there's still a number of people out there whose experience of COVID-19 and long COVID is limited to cough, cold, and a period of isolation. Some individuals have also never really had any, fortunately, never had a close friend, family member, colleague, they themselves have not been exposed to an extreme version of the virus. And as such, until that really happens, until there's like this almost penny drop moment for some individuals, they don't really understand just how bad an impact and how much of an affliction getting the virus can be on another person. So I think what I'm trying to say is, for coaches who haven't seen the worst kind of situation, they don't yet appreciate the impacts and the positive change and the intervention that they could make with someone. And certainly what we found very recently, actually, I had a message last night, just quick anecdotal thing. I had a message last night from a coach who, in his own words, said he'd had a kick up the ass in the last couple of days because a number of his friends had got the virus, and his uncle had been put into an induced coma as part of trying to rehabilitate him out of his COVID situation. And he said, in his words, he felt he hadn't paid the virus enough respect. He now understood the impacts it can have, and he wanted to be a part of helping his friends and family move forward. So there's still sort of a bit of an awareness exercise that we can play as an organisation to let coaches know what could happen. And there's a number of projects that we're involved in there, Col, aren't we, with different personal trainer groups, etc., to help with that. But similarly, same with consumers. You know, if you're a consumer who's not had any friends, family members, colleagues, etc., who've been seriously impacted by the virus, you kind of don't quite get it yet. So then if the virus hits you and you're not really aware of the negative impacts that the virus could present further down the line, if it's not treated with this kind of respect, then that's often where long COVID can set in. So we've talked before, just a couple of moments ago, about there's so much of a focus on the problem rather than the aftermath of that. So we're trying to develop the relationships that we have and broaden the context of some of the messages that the media is sharing around the need to be careful in the event that you contract COVID-19, how to treat it with respect, the phrase we keep using here, and focus less on the sort of the problem and the escalation of the virus, and understand more about the impact it can have on your body, and then some necessary steps that you need to do to protect yourself to come out of it on the other side in the safest possible way. At a very basic level, ground level, for the clubs and the coaches that we're working with, we are producing some, let's call them marketing packs, that helps you guys to spread the message across your local communities that you're the local rehabilitation resource centre. And also, following some conversations with ukactive in the last week or so, we're also preparing a government letter that will be included in those packs that can be sent from individuals who've been working with a rebuild coach, that they can then send to their local government representative to explain the difference that the rebuild coach has had on their own COVID-19 recovery, so that we can start to share this message of social proof about the work that we're doing as a sector back to the government, in the hope that we can get more recognition and potentially more funding to help us as a sector to roll this out more widely. Again, as part of that, Col and I are currently actively seeking sponsorship support, not for our business, but because we would love to be able to put out bigger consumer awareness campaigns that they can come to the club and they can come to the coach in order to access help. This initiative, this project, is completely self-funded by Col and I. So sadly, we don't have the readies to be able to get behind it in a big mass population awareness campaign. So that's also something that we're tackling away at behind the scenes. So in between time, surely I'm absolutely in belief that you guys are on page with the purpose of this and where it's been headed and why. But from a business perspective as well, and there's a phrase that you always use, Col, about there's no harm in looking at it as an opportunity. I forget the phrase that you use now. But as business leaders, it will have a positive impact on our business if we are able to set up these rehab programs through our facilities correctly. We've talked endlessly about the community aspect that this plays and the leadership that it demonstrates in our local communities if we're able to step up and provide a local resource for rehabilitation at a time when our communities need it most. But for us to be part of the solution in that way, again, as we were talking with UK Active on this week, it's a further reason for our gyms to stay open. If we can help to solve this problem and get people back to full health far quicker than if they were operating independently, why not let people work with us and come into our facilities and get well? Retention tool and added value for existing members. We have members and clients that have COVID. This is already happening, and they're asking coaches for help. What we want to be able to do is work with clubs and with coaches so that when the members and clients ask the question, you have a response ready to go and you're able to step in. We've also seen that referrals are happening in a different kind of way. Like, even if a member and client hasn't got COVID-19 or long COVID themselves, most people now know someone who has and who is in a predicament and who needs help. So a different type of referral is coming through now. Clubs are still closed, obviously, for the most part, across the world. Carl and I created all the content that we've produced during a lockdown, at a time when we didn't know whether lockdown would end. So everything that we do is based off of the fact that clubs could be closed at any point. The point is, there's no reason why we can't be helping individuals now digitally, despite the fact that our clubs are closed. And we've actually found that in instances where that's happening, it's creating a bit of a member pipeline for then when the clubs reopen, for new individuals to come into our facilities when we're back at full capacity. And of course, it's a gateway to PT. As Jan said early on in the video, she'd never really had any one-to-one experience or a huge relationship with a personal trainer at any point, but her relationship with Chris has led to a new type of paid-for one-to-one service to help her through her COVID-19 recovery. But as they both talked about at the very front end of this, that relationship doesn't end with COVID-19. Now Jan has to work through her decondition period. And then by that point, you've already seen the level of relationship that they have. They then have a unique partnership where they'll be working together moving forward for the longer term. So to finish up and to make sure that you guys have some bits that you could take away with you right now, there are 3 simple things that people watching this can do straight away. Number 1 is, on the awareness piece, let coaches know that this is a thing, that COVID-19 and long COVID isn't to be taken lightly. One of the worst things that could happen is that people who have endured COVID-19, as Cole said before, tried to push too hard too soon, work with a coach at the same level they did previously, maybe throw in, God forbid, some high intensity work, etc. It could very well likely have negative repercussions. The role of the coach in this instance is to provide, exactly as Chris did with Jan, the limiting pace factor as to how quickly to return to the level of exercise they worked at before. So if we can just let coaches know it is real, it is a thing, and to be mindful of that and not to go hard at it too early, that could make a massive difference to thousands of people. The other thing is to listen. Don't dismiss it. Don't dismiss what people are going through if they're still coming out of the other side of COVID-19. And use the opportunity to open our ears and open our doors to people closest to us and our member and client community, like Jan, again, who needs a community right now to share their woes and understand where they're coming from and understand their frustrations. And then the third thing is, which actually came from Tomo, which is one of our coaches in the world, actually one of the coaches that works out of the gym that Cole owns. And Tomo had put something forward which now a lot of our coaches are adopting, and we recommend it to any coach really, is to put out client assessments to everyone. Now, we all do client assessments all the time, but if there's an opportunity to do a client health assessment, whether they've had COVID or they haven't had COVID, means that in the event that a client contracts COVID-19, you've got a history then of data, of health data, so you knew where they were at pre-COVID. So then therefore, once they've contracted the virus and you start working with an individual post-COVID, you have an exact comparison of where they've come from. That's a really nice, tangible way to illustrate to them the impact the virus has had on them. And it gives you some like up-to-date real-time data to help to move forward with the person. But almost moreover, it demonstrates, again, as a sector, our leadership and our proactivity in terms of wanting to preserve their health for the future. And it's something that's super simple and super quick that you can be doing right now in the backdrop of COVID-19. Last piece from us, really, before we dive into some questions. There's lots of, we've sort of skimmed the surface on a lot of topics there, and there's lots to pack in. And I said at the very front end, this is part one of lots of moving pieces. So to keep you guys updated in terms of how we're progressing with a lot of the conversations that we're having, the collective voice of all the clubs and coaches that we're working with and so on, we will be working with ukactive to deliver sector-specific workshops, delivering these updates and other tangible hands-on activities that you guys can get involved in from February. So we'll start to communicate those. Similarly, we'll be working with club industry across the US to do regional workshops in a similar kind of way. And then as an organisation here, we will be launching in February our own employer and coach steering group that will help us to define and make some key decisions as we start to best represent us as a sector in some of the conversations and the research initiatives that we're starting to be involved in. Last comment from me, really, and on behalf of us both, is if there's one thing that you guys take away from this presentation, is our invitation to you guys to get behind the message that the club and the coach is the solution in this, and we are one voice in this, and we can work together to affect massive change. Before we leave you guys to kick into your Friday afternoons and any homeschooling chaos that people might have hidden away from for the last hour, we just wanted to open the floor up to any questions.
Can people unmute, or do they have to put it in the chat box, Mel?
Oh, good point. Chat box, please, if that's okay. Anything else key, Cole, just while we wait on that I may have missed there at the end?
I think we've covered a lot there, and hopefully people will be able to unpack that and take a lot from it. I think the key thing is to recognise that whilst there's a ton of other things going on, there is a huge part of this that we play a leading role in, which is those people who are going to go through, deal with very moderate to low-level symptoms, but then be left with the tail end of it that's quite complicated. And that's for us to work with and to put right. It falls directly into our lap. So the numbers are growing, the need is growing, and also there's nothing wrong with recognizing that what COVID-19 has done has brought a whole new wave of attention towards health and well-being, and people are looking for solutions. And the ukactive themselves reported the paper just recently that showed a 70% increase in interest in health. So there is nothing wrong with harnessing that, because what we want to do is help people to live better and to have better quality of life. There's nothing wrong with taking advantage of that attention.
Agreed.
There's
okay.
No questions, Mel, so we
No
can
questions.
release people. Thank you for your time, folks. It is appreciated.
Take care, guys, and we'll follow up with everybody individually.
Oh,
in case there's
there's a question, Mel.
Go on, click away.
Yeah. Are you planning on interested in setting guidance for approved cause centres?
I'll let you answer that.
Putting it in that frame like framing it that way is probably slightly different to what we'd looked at. What we, as a part of our coaches registry, which is to let people know who's cause qualified within an area, we had the notion of, specific gyms whereby there's a critical mass. So where they've got, multiples of cause, certified coaches, and that we would let people know that not a hotspot, but there was an area that had quite a good provision for it. But I like that. I like the framework that you've put on that, the kind of notion of it. And I think that's something we should follow up, is to be that kind of formal about it. I think that's a great idea. Thank you.
Yeah, for now we've only referred to our club partners as cause rebuild facilities, but as you say, Carl, the framework notion to add a bit more authority to it, if it supports clubs, is worth considering. Have we got another question there as well?
No, just to comment off the back of that, which I agree with. Yeah, it'd be good for local awareness and reason for local authority to contact gyms. Absolutely, yeah, totally agree. That's 100% a part of the strategy that we'll take on board. Yeah, thanks, Marvin. Thank you.
Is there a third? I keep seeing bits crop up. No?
He just said thanks, that he enjoyed the workshop.
Yeah.
I can't believe you can't see it.
Thanks, Marv. Right, okay, we'll leave you guys in peace. Have a lovely Friday and a relaxing weekend, and stay super safe.
Brilliant. Thanks. Bye now. Thank you.
Bye, guys.